The idea of sepsis is that the body is trying to fight, but the body is being overwhelmed by the bacteria. So you see it as a war that is going on between A and B, A being the body, B being the bacteria. So hello guys, welcome back to this channel. This is Dr. Lovable and I'm so happy to have you here. If you're watching this video and you're yet to subscribe, please click the subscribe button. Quickly, we'll be talking about what we call sepsis. Sepsis is one of the most common diagnoses I've seen in clinic. And most times when I tell patients that their baby or their relative has sepsis, they tend to get lost. Like, what is sepsis? That is the reason why I'm doing this video, to educate you guys on what sepsis is. So sepsis is a term that entails the body's response to infection. When there is an infection, how the body responds to it is what brings about sepsis. Now, what happens? This infection can be of different routes. Most times, once I tell patients that your baby has an infection, they feel like it's a genital infection or a sexually transmitted infection. No, in this case, it's not really that aspect. Though yes, that can also result in sepsis. But the idea of sepsis is that there is a bacterial infection. There is either bacterial infection or viral infection, even parasitic. It can be antibody, meaning that there is something going on. There is an organism that is in the body that is causing the body to produce antibodies to fight against that infection. When there is a bacteria, or for example, I'm using bacteria in this case because majority of the sepsis we see are mostly of bacterial origins. So today I'm going to be talking more of bacterial sepsis. Once there is a bacterial infection, the body begins to try its best to fight off these infections. Now, what happens is that while if this is just a simple small infection, the body can easily fight it off. But in a case whereby there is increased bacterial load, what happens is that these responses become something else, in the sense that part of the complications of the responses is that this inflammatory products that are being released by the cytokines will cause a generalized inflammation in the body. And when there is that generalized inflammation, it causes the coagulation pathway to be activated. And once the coagulation pathway is activated, it begins to form clots in the blood vessels. And these clots can block some of these small vessels that supply some of these organs. Once it does that, you begin to get what we call organ damage. You start seeing that the kidney is affected, the brain is affected, the heart itself is affected. So this is what happens in sepsis. It's a stage by stage something. So the first thing you see is the sepsis, next thing you see is the severe sepsis, and then the last is the septic shock, whereby the patient goes into coma due to, and also not just coma but organ damage. That's what we're talking about now. So we'll talk about who are the people at risk of having sepsis. Extremes of age: those that are very young, like little children, and those that are very old, like from 65 years and above. The idea of sepsis is that the body is trying to fight, but the body is being overwhelmed by the bacteria. So you see it as a war that is going on between A and B, A being the body, B being the bacteria. So sepsis happens when the bacteria is winning the body. That's what happens in sepsis. But most times when we just have some little illness and we recover, what happens is that the body fought and the body won. You get it? So that's why people who are immunocompromised are also at increased risk of coming down with sepsis. Some of the symptoms of sepsis you can see is very high fever. We call it hyperthermia. And for this not to make you confused, also, we have hypothermia in sepsis, meaning that you might be seeing your child having a very funny kind of temperature, something like 32, 33. That is a sign of sepsis. It's not all sepsis that comes with hypothermia. So when you see a temperature that is very low, it's also a symptom of sepsis. Next thing you can see other symptoms of the condition, because like I said, any infection can cause sepsis. Infection can either be respiratory infection, it can either be digestive infection, it can be genital infection. So whatever, urinary infection, just the main thing is that anything that brings about a pathogen into the body can lead to sepsis. Apart from the symptoms which I mentioned, There is also increased heart rate. There is also increased respiration. All these are ways to show that the body is trying to compensate for what is going on. It's trying to give you a signal that, oh, I can't fight this anymore. I'm getting tired. I can't do this. It's getting too much. That is how the body is telling you what is going on. So when you begin to see all these kind of symptoms, you see your child is having very high fever, you see your child is breathing very fast, you notice that the pulse is very fast, or the child is very irritable, please come down to the hospital, because this is already a sign of ongoing sepsis. And if it is not handled properly, it can progress into the severe sepsis. Before you know it, we are going to we are going to septic shock. It is not what we want. If we can manage it early, why not come early? So the next thing I would like to also let you know is that once sepsis has been diagnosed, one of the ways we can diagnose it also is to run some tests. When you run some tests, you run the full blood count, which the WBC, which is the white blood cell count, will be very elevated. That is also one of the signs that this might be sepsis. It's very elevated, showing that the body has produced so much white blood cells to fight this infection, and yet nothing is going on. That is a sign. So what happens now is that once you come down to the hospital, we'll assess your child, we'll take history, run some investigations, and then commence appropriate antibiotics, commence the appropriate treatment to reduce the bacterial load. Once this has been done, that child can make a full recovery. But when the child has come down with so much complications, kidney issues, liver issues, and all, it becomes more difficult for the doctors to manage. This is still me talking about early presentation is the key. Early presentation is the key. So I hope you've learned something from this video, so that next time when your doctor tells you, oh, your baby has sepsis, you know what sepsis is and you know what it is all about. See you next time. Thank you for watching and have a nice day. Bye.